Hi, friends. Thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. I am genuinely so excited for this interview. I get to bring my dear friend Kaylee Blair back on to co-host with me as we interview the fabulous Dr. Diane Spangler. Dr. Spangler was on the podcast back on episode 55. That one was called Depression, Anxiety, and Mental Health Post-Concussion, and is honestly one of my favorite episodes that I share with people. I just feel like she did such a beautiful job of explaining how and why mental health concerns come up post-concussion and what can be done to address them. It is seriously quality information, and I highly recommend that if you haven't listened to it yet, you go back and check it out. We discussed really important topics like, as in the title, depression and anxiety and PTSD and grief and many other really pertinent things. So I will link to that in the show notes. It's episode 55. Listen to it. You will not regret it. And if you have heard it, you will know why I'm so thrilled to have Dr. Spangler joining us again today. Immediately after our conversation last time, I wrote down a huge list of topics and questions that I wanted to pick her brain more about. So I am very grateful that she's willing to come back and share more of her wisdom with us. Dr. Spangler is a clinical psychologist with over 20 years of experience working in both clinical and academic settings. She earned her doctorate degree in clinical psychology at the University of Oregon, followed by a postdoctoral research fellowship in the Department of Psychiatry at the Stanford University School of Medicine. Dr. Spangler served as a professor of psychology at Brigham Young University for 15 years. She also served as a visiting professor in the Department of Psychiatry, Cognitive Therapy Center at Oxford University in England. Dr. Spangler has authored over 60 publications and has lectured worldwide. We are so honored to have you back on the podcast today, Dr. Spangler. Thank you for joining us.
My pleasure. It's good to be back with you and your listeners.
Yay, thank you. So first off, I guess, are there any updates or exciting things that you want to share with us since our last interview, which was posted back in February of 2024?
There have been some changes to my private practice. So I moved my private practice. It's now located in Provo, but I do a lot of remote work as well to people kind of all over the U.S. And I was able to expand in that move the services that I can offer, the ones that would be more pertinent to concussion. People are struggling with concussion and then maybe some comorbid psychological issues, is that I can blend some of the work that I do psychologically with transcranial magnetic stimulation for those it's appropriate for. And then for those that are dealing with anxiety, panic, I can now offer doing some trauma exposure work while in the CO2 suit to keep their body really calm while they're re-experiencing trauma, as well as people with panic, doing some breathing retraining. So being in my new location has really allowed me to expand service and better serve people with mental health issues, but also the comorbidity of mental health with concussion. So I'm excited about that. It really,
that's
something
amazing.
I've been wanting. Yeah, it's something I've been wanting to do for quite a while, and I'm glad it just kind of all came together.
Oh my gosh, I feel like we could do an entire episode on just what you just said, the things that you're working on. Wow. Okay. Well, just as a super brief overview, can you tell people what TMS or transcranial magnetic stimulation is? And also the CO2 suit, how that helps. I know those are two separate things, but yes, if you could just touch on those so that people are aware, that would be awesome.
So transcranial magnetic stimulation is a treatment that has been developed. It was developed specifically for depression, although the applications are widening. It's been FDA approved at this point for treatment-resistant depression and OCD. There's experimental work being done on other disorders like migraine, and there's some other countries they're looking at for dementia. So, but what it does, it's non-invasive, and it works to stimulate particular areas of the brain that have been found to be problematic in particular things like in depression. So it stimulates activation of those areas. And there's been different protocols developed. And the most cutting edge, most recent is called the SAINT protocol. And here at Cognitive FX, and also people that would come to that through my private practice, we do use the SAINT protocol, but we also, it's fMRI guided and neuronavigated. And so the location is very precise, where most that offer TMS don't offer SAINT and don't offer fMRI guided neuronavigated. So using SAINT with those neuronavigations and fMRI guided, you can only get that 10 places in the US right now.
Wow, that is so cool. And I assume that you're seeing good results from this. Is this why you're like excited about going into this more?
Yeah, results with TMS are really quite impressive. And again, it's with the FDA approval is for treatment-resistant depression. So these are people that have tried multiple different forms of treatment and have, really not had much response to those, tried all different kinds of medications, different kinds of psychotherapy, things like that. And the response rate, so for the SAINT protocol, it's a week long and you're there all day and you get 10 administrations per day for 5 days straight, where more traditional TMS, you would be going every day for just 30 minutes, but you go for like 6 to 8 weeks. So it really disrupts people's lives to try and do TMS kind of the old way. So SAINT is much more intensive and a lot more short-lived. It has very few side effects, unlike, say, antidepressant medication, and it's very fast-acting. So the response rates are look really good. And there's still research kind of out on sustainability of effect. So we need more long-term data. But again, we're real excited to be able to offer that to who it's appropriate for.
That's amazing. Oh, I really, really love that. I have people in my mind, I'm like, oh, I should have them check this out. Tell us also a little bit, if you wouldn't mind, about the CO2 suit and the trauma exposure while in that.
Yes. So in working with trauma, there's a large body piece to working with trauma. Certainly there's a psychological piece, and there's a lot of work to be done on the mind. But trauma is done to the body typically. And certainly there's trauma that can be done to the mind as well. And so it's really important to be able to do some integrative work that involves working on the mind while also being able to put the body in a calm state, because when the body is very traumatized, it's hard to do cognitive processing when you're in a high fear state. And so I've been doing some cognitive processing work of trauma while people are in the CO2 suit so that their body can be calm while we're revisiting those things. So it's the work that I've been doing with that has been really promising so far. And it's just I think a really useful way to do trauma work.
That is so cool. I just really love the integration of these things and being able, like the way that it's able to help people in a unique way that might work for them in a way that other things that they've tried haven't. And just throwing this out there for people who might be confused about what a CO2 suit is, because I had never heard of it before I worked there at Cognitive Effects. It's basically, actually, maybe I should have Kaylee. Kaylee, do you want to describe to us what a CO2 suit is, like what it's useful for?
Sure. It's kind of the opposite of what you want. So a lot of people talk about hyperbaric chamber, and this is kind of the opposite effect. They found that if you use the body with CO2 rather than oxygen, you actually take in more oxygen, because CO2 dilates blood vessels, whereas oxygen tends to constrict them. And so that's as far as I understand it. And so it tends to bring even more of a calming effect and impact to the body, because you're actually able to receive the oxygen and take in more of it.
And basically, tell me if I'm wrong, but it kind of looks like an astronaut suit, right? Like you're around, but your head is free and breathing air. So like normal air. So anyway, super, super interesting. Thank you for sharing that. We'll have to.
And then I'll just quickly also say that with people that are experiencing panic disorder, it's really common in panic disorder for people to have breathing issues. And so kind of right across the way, breathing retraining experts that I can do joint work with for people with panic that are fantastic to help with breathing retraining, in addition to the more psychological things we'd be doing to help with panic disorder.
Oh my gosh, I love everything that you're doing. These are like, yeah, it's not just like the traditional thing, but you're using all of these different modalities that can just amplify the effectiveness of what you're already bringing to it as far as the psychology piece. So that's really, really wonderful. Thank you for sharing that. And I hope people look into it. So I'm glad that we're putting this out there. And yeah, I had no idea about that stuff. So very cool. Thanks for sharing that. So, and we have so many questions for you, and they're kind of all over the board. So get ready to jump around here with us. So Kaylee will bring up the first topic. And yeah, I'll let you jump in, Kaylee, about you had questions for her about pain and chronic and acute and all of that. So ready, go.
Yep. Yeah. Yep, exactly. So I'm curious how you work with people dealing with acute pain versus chronic pain. I'm assuming that there are different things you do for them, maybe not. And any suggestions you have for people who are dealing with both or either or?
So pain is a tricky one. And certainly it probably goes without saying that it's always going to be a two-pronged approach in the sense of paying attention to body and mind, and of course their interaction. So I would always be recommending that someone in physical pain be consulting with a physical pain specialist in terms of assessment, as well as the different sorts of treatment that might be relevant to whatever the assessment shows in terms of the physical pain. So that's something I would refer out for. That's not really my specialty in pain. Mine is more the mind and pain. So, when people think about pain management, I think there's a lot of concern about opioid use, and as there should be, but there's a lot of physical interventions that can be tried depending on the nature of the pain that wouldn't necessarily involve opioid use. And so I would, again, be wanting to work as sort of a team for the patient. That they've got someone who's really checking into and assessing well and giving them different options for the physical pain part. But the mind in pain is really important too, and it is different for acute and chronic. So acute pain is people are just trying to, in essence, survive it, right? So there is a natural reaction to want to resist pain. And of course, you want to get rid of pain and that sort of thing. But when you're in really acute pain, if you're resisting it, you're often increasing it because you're you're tensing the body. The body is in sort of a fight stage. So it's counterintuitive a bit for someone in acute pain. But often if someone's in quite acute pain, they're really in a medical setting. They're not in my office. So that would be a little bit different too, in terms of, so I typically would be seeing someone who has more of a chronic issue that they're trying to deal with, chronic pain that sometimes can become, very extreme and acute. But when it comes very, very extreme, then they're likely going to the ER, not coming to my office.
Yeah.
But in terms of handling pain, whether it's acute or more chronic pain tends to be a little less severe in the sense that it's ongoing. And so you're sort of in a position to having to tolerate it. And so in terms of psychological, I'm going to be talking with people about things like how they're reacting to their pain, and particularly how they're reacting to particular physiologic sensations. So if you think about pain as a physiologic sensation, it's going to be occurring in a different parts of people's bodies, and so one of the things to do is to just sort of be identifying where that pain is coming from, where they're feeling it in their body, and then what their reaction to it is, both in terms of what their bodily reaction to it is. Are they tensing up? Do they have certain thoughts about the pain? Do they have beliefs about their pain? And one of the really common responses to pain is certainly resistance, but also there's a term called interoceptive sensitivity, where if you notice a certain kind of physiologic sensation, that there's a threat reaction to those sensations. So particular kinds of pain or physical sensations, people can then have what's called interoceptive conditioning, where their body starts to automatically respond to those sensations with a threat reaction. And as soon as your body has a threat reaction, you're going to have a flood more physical sensation, and you're going to increase tension in the body and increase heart rate and things like that. And so it's likely to amplify pain. So in working with the body and pain, I would be working with people's natural reaction to resist, because in chronic pain, oftentimes the resistance of it is going to make it worse, which again seems counterintuitive, because of course we want to resist pain. So there's different ways to react in terms cognitively and also in your body to the pain itself. So those are the sorts of things, and that would be personalized to the person in terms of what their cognitive reactions are to pain and what their bodily reactions are to those sort of pain physical sensations. And sometimes what people can sort of start to realize is that they can actually handle the initial sensation. I mean, it's not pleasant and they don't really want it, but it's the reaction to the sensation that really amplifies it. And if you can bring down some of those things, then the pain is more tolerable. And you can even do things like change attention levels to it. So instead of it being in the foreground, which pain kind of screams for attention, there are things that you can do to move pain into the background. And one of the things I think that can be frustrating for people with pain is that if they pursue or are told to pursue something of a psychological kind of intervention to help with the pain, there's this idea that they're being told that the pain is all in their head, which I think is offensive.
Yeah.
Because the pain is real. And again, there's that body part of it that I certainly want them to be addressing as well. And so doing psychological intervention for pain doesn't necessarily assume that one is creating the pain or that the pain isn't sort of real or it's all in your head. And that's really insulting to suggest to people. And again, that's not really where I'm coming from. I'm coming from what are the cognitive and bodily reactions to the initial physical sensation. And there's a lot that can be done to alter those to help people manage pain.
Is it kind of going along the lines of building resilience to those types of situations, especially with people with chronic pain? I feel like resilience is a term I hear a lot lately.
Yeah, so people will talk about coping strategies. And so what I'm talking about is a bit broader than that, because it's really about changing their experience of pain cognitively and in their body, as well as certainly there are some coping things that one can develop, but it's a much broader net than let's come up with some things you can do when you're in pain, although that's a useful thing to do as well.
Sure. Thank you.
So one of the things, well, maybe I'll just stop there and let you tell me if you want follow-up from any of that.
Yeah, I have a couple more questions for you with this. When you're talking about moving it, the attention that you give to it and rather moving it from the foreground to the background, do you have are there any tips or things that you can offer people who are listening to this that they might be able to try that could help that? And I'll let you go with that one. Then I have another question follow up to that one as well.
So pain is demanding, and it should be, in that our systems initially, when we feel pain, that should be a high priority, high attention grabbing. But if you're talking about chronic pain and it's always grabbing your attention, that starts to really interfere. And it's not something, because usually if you're dealing with chronic pain, there isn't an emergent issue. You've already addressed if there was something emergent about it, meaning emergency. And so when you have chronic pain, pain is still going to scream for attention. When you have chronic pain, it doesn't really deserve attention because there's no emergency to deal with. You're not in immediate danger. And so that's the shifting of attention. And part of the reaction is that just because I have this physical sensation and it's screaming at me doesn't mean it gets to have my attention. So there's different things that you can use to redirect attention, to acknowledge that thanks. You can kind of pat it on the head. I know you're just doing your job, which is to alert me to things that might potentially be dangerous or whatever, but I know what this pain is and it isn't really dangerous. There's also mindfulness kinds of practices that people can practice whether they're in pain or not, to be able to notice and acknowledge the pain and then redirect or just let it kind of be there parallel to other things without trying to resist it, without trying to judge it, without trying to change it. And it's just, it sounds sort of simple on the face of it, but it really does require a lot of practice to do that. And when people are able to just have kind of non-judgmental observance of pain, it can be incredibly helpful. So John Kabat-Zinn was a Harvard provider, and he developed, so mindfulness and meditative practices has been around since ancient times, but it's only relatively more recently that it's been brought into kind of Western medicine. And John Kabat-Zinn was one of the pioneers of that. And when he first was bringing in these sort of mindfulness practices, his whole focus was to use for people with chronic medical conditions that involved a lot of pain. And so his whole career, which was, quite a impressive career, was using these for chronic pain management. And his whole program is incredibly helpful for people in chronic pain. And it was meant to be used instead of, or sometimes in concert with, more medication-based or, medical intervention-based ways of handling chronic pain. And it's, really impressive in terms of how helpful those sorts of things are.
Wonderful. Thank you for sharing that. And we will dive more into mindfulness in a little bit here. So I appreciate you bringing that up. And I think it also, follow-up question I was going to ask about the having it go into the background is, some people might hear that and be like, oh, but I thought we weren't supposed to resist it. We weren't supposed to is ignoring it okay? But I think you did a good job of saying that's not the case. We're not resisting it. We're allowing it to be and acknowledging that it can be there and we can do other things as well. I think that was a good way of putting it. And we're not just ignoring it or pushing it aside, but we are allowing our attention and focus to be elsewhere if it's not an emergency thing. So
yes.
Very good point there. And another super quick question on the pain topic. And again, this might be broad, but you can let me know if it's too broad. But is there any advice that you have for loved ones who are trying to know how to best support someone who is in pain a lot? It comes out, and I imagine those relationships, it can be straining or challenging in those situations. Do you have any suggestions for people who are loving and trying to support someone?
Yeah, so there would probably be some sort of background conversations that they should have when the person isn't necessarily in their highest pain point. Like when they're kind of in chronic pain, they're probably typically have some level of pain. But when they're in a kind of a lower level of pain, is to have some conversations about when the person is spiking in pain or is having a moment where it's like, I'm just so tired of being in pain, even if they're not in a high level of pain. But when they're in a high level of pain, kind of prior to that, to talk to the person about and have a conversation about what do they want in those moments? What is most helpful? Because it's hard to see someone that you care about be in pain. And so sometimes people kind of automatically start to respond like, here, try this, do this. And the person that's in pain gets sort of bombarded or even annoyed. And also there can be sort of almost a Pollyanna piece to that, which can be very annoying to someone in chronic pain. They're like, oh, do this and it'll get better, or try this, or you should fight it. And that's not necessarily what is helpful. So in the loved one's desire to help, they're often being very unhelpful. So it's sort of a saying among providers that one of the worst things, or the things that most gets in the way of providers, is their desire to help, which again, seems kind of counterintuitive, but the sort of meaning of that is trying to jump in with all these solutions when the person's like, that's not helpful. I don't need that. That's not what I want right now, or I'm not willing to do that. It's like we just bombard people. So it would be having that conversation prior to high pain about when you're in high pain, what is it that you need? Do you want to be left alone? Can we right now talk about things that you think might be helpful? Would you want some suggestions from me right now? Or is it something you want to figure out on your own? Or do you already know what you need in those moments? And that way, when those high pain times come, the loved one isn't bombarding the person with things they don't want or they don't find helpful.
That's really helpful advice. Thank you. Another interesting symptom that I've heard from multiple people is that following their concussion, they feel dissociated from their bodies. I've heard them say that it's like an out-of-body experience. I'm just curious, is that a common symptom that you've heard about as well? And if so, why does it happen? What can we do about it? Just interested in bringing this up and hearing what you have to say.
Yeah, so asking about more dissociative states is really a nice segue from pain, because we all have the capacity for dissociation. And one of the reasons we have the capacity is because it can help us escape painful situations, whether that's physical pain or psychological pain, emotional pain. But if you think about dissociation, it really occurs on a continuum. So, for example, if you're in a really boring lecture, you might find yourself sort of going somewhere else, and you can deliberately direct that, or sometimes it just spontaneously happens that you sort of wander, and then you really are kind of somewhere else, and all of a sudden there'll be a loud noise, or there'll be something that comes up on the screen during the lecture, and all of a sudden you pop back in and you're like, whoa, where was I? So that is dissociation, right? You're sort of somewhere else. Not just situationally, but you really don't even feel like you're necessarily in your body.
That's so interesting. Yes, I know what you're talking about, but I never would have thought of that as dissociation. So that's super fascinating. Keep going.
Yes. So when you say, is it common? Yes, in the sense it's a capacity that we all have and that we use it. And sometimes we use it very deliberately, like, oh, I don't care about this, I'm going to check out, and sometimes it just naturally comes upon us. Like sometimes it even happens when we're driving, and all of a sudden we find ourselves home and we don't even remember having driven there.
Yes.
And we're sort of somewhere else, but the automatic stuff's still going. It's a route that we know really well, so we're not really attending to it. So we don't really intentionally kind of check out, but we do it. So if you think about dissociation on that kind of a continuum, then yes, of course, it's very common. But if you're thinking about on the higher end of the continuum, when dissociation maybe becomes more in a clinical range, that happens more often with trauma. And then it starts to be something that can, on the one hand, be helpful in a particular moment, but be more dysfunctional if used a lot, or your system kind of goes into that in ways that start to disrupt your functioning. So that kind of disassociation is not super common in concussion, but it does happen, that people will experience more of a high level of it, and one that doesn't feel like something they're deliberately doing. And there's different things that can contribute to that. So one thing that can contribute to that is pain or uncomfortable states. So dissociation is something that the mind and body use when in high states of pain or discomfort. And so concussion certainly produces pain and discomfort of a variety of those. So people might find themselves going into dissociation to kind of deal with some of that. But there are also perceptual changes that can happen as part of a head injury that make that state more likely. And because they're having perceptual issues, so people feel like I'm not quite in my body, or something doesn't feel right, or kind of visual and tactile things aren't linking up, or I don't quite know where I am in space. That those things can all be something that are part of concussion or head injury or TBI, that can put people have those same sort of sensations. And those sensations are often disorienting and disturbing. And when they're disturbing, people then typically experience some anxiety. And if you experience high anxiety, when you're in a high anxiety state, typically you also have some dissociative sensations. So one of the symptoms of a panic attack is that dissociated, derealized, depersonalized, that those are symptoms of panic attack. There are other ones too, of course, like high heart rate and, some visual changes and, high anxiety, of course. And so again, there's kind of multiple things that could be contributing to dissociation in concussion.
That is fascinating. And if you find somebody who has been feeling like they're stuck in it, or that's a pattern that their body is like repeatedly going to,
Yeah.
I assume that getting help for some of those underlying things, the pain and the perceptual issues, like those are physical things that may be able to be addressed individually that could probably help make it less likely to keep jumping to that.
Yeah.
I'm guessing, but please tell me if I'm wrong. And are there other things that you can work on that can help people stay in their bodies?
Yeah. So one of the common ones is what's called grounding. So doing things to particularly focus on what is occurring in the present moment and what is occurring in the body, so that you're bringing yourself back to the body and back to the present moment, so that you're not so depersonalized and not, it's kind of disoriented. So examples would be specifically checking in with your body in terms of what are, feeling my feet on the ground, what are, several things that I sense right now in my sort of tactile. Do I feel my clothes? Do I feel the chair? What do my feet feel like in my shoes or on the ground? What am I hearing right now? So describe 3 things that you hear in the moment. Describe 3 things that you see. So when people are feeling like I don't know where I am in space, or what, is to just really orient to where you are in space and where you are in your body.
Yes.
And that can
So
help in that kind of moment.
Mm-hmm. Thank you. Go ahead, Kaylee.
Sorry. Before we move on from it, I was curious. So when we talked about pain, you talked about, especially the chronic pain, talked about acknowledging it, but choosing to have your attention elsewhere, that type of a thing.
Yeah.
Is that kind of a form of disassociation, but like intentional, and it's a kind of a good way to use it, essentially?
Yeah, so there's a distinction between dissociation and distraction.
Okay.
So again, sometimes people use distraction with chronic pain, which I don't think is necessarily a problematic thing to do in an arsenal. It just shouldn't be the only thing one does, or that one gets into a distractive avoidance state where you're just doing whatever's distracting for you, or that's playing a video game or scrolling on your phone or, watching TV or drinking or something like that. I wouldn't, there's certain things to use for distraction that would be poor choices, but that would be deliberate distraction. And again, there is a place for that. I just don't think it's, for example, if you're getting a really painful medical procedure and you want to use distraction during the procedure, by all means, but if you typically, that's all you're doing, then it becomes problematic. But distraction is not dissociation.
Yeah.
Again, dissociation is when you're sort of leaving your present. You're like, I don't feel like I'm depersonalized, I'm derealized, like I'm not here. And that's a more problematic state when you don't feel like you have control over it.
Gotcha.
Or it's sort of automatically happening all the time.
Okay. Thank you.
And
does that address your question?
It did. It gave some distinction, because I think that sometimes with disassociation, there can be a fear surrounding it because there's a lack of control, which that's understandable. Yeah. But I was curious, just kind of like just defining more often, like what's considered like, okay, now I need help as far as the disassociation is concerned, versus what can even be kind of useful, which we learned is the intentional distractions in a good way. So I was just curious about that.
Yeah. So dissociation, if it's happening often and is disrupting your functioning, that's a time to seek treatment for it. If it feels really out of control, I mean, again, there's that sort of automatic, you're in a boring lecture and you might not dissociate on purpose, but all of a sudden you find yourself, I wouldn't call that out of control. Like, you're going to have times when it just spontaneously occurs. But if it's occurring a lot and you're feeling like, this is really problematic and disrupting. The other time to seek some treatment is when you're experiencing dissociation at the higher end of the continuum, and it is becoming very upsetting to you and you're having a really hard time tolerating it. It's scaring you. And of course, it's disrupting functioning.
Yeah, thank you. I appreciate you bringing that question up, Kaylee, as to when to seek help for it. And I love what you were saying, Dr. Spangler, about the grounding and being in the moment and like kind of bringing yourself here. And it's so fascinating to me just how, our minds and our bodies are so connected. Like the way that you bring your mind back into your body is by getting into your body.
Yes, yeah.
They're so related. And I think this might be a good segue into the mindfulness topic. Is in my mind, I've associated grounding with a mindfulness practice. Are they similar? I know you have a lot to say about mindfulness. You practice it. You run a mindfulness group. So I would, just love to hear your thoughts on mindfulness, why it's helpful, and how you use it to help people.
Yeah, so mindfulness is typically seen as something that you would do as a practice. So something you'd practice every day, or sort of like, you work out your body on a regular basis through exercise. That mindfulness would be seen as a practice for the mind to help with sort of just general mental wellness, but can also be applied in very specific ways to help with certain problems, just like you might go to a physical therapist to do certain kinds of body movements to help with certain kinds of physical problems. So again, mindfulness can be used as an overall wellness, but it can also be used to help with more targeted kinds of issues. So mindfulness is practicing the capacity to have non-judgmental observance of different aspects of being. So of bodily sensations, of mental events, of emotions, of sensations, or even the external world. Like an example would be sometimes there would be like going on a mindfulness walk where you pay really close attention to how your feet feel on the ground. And then you just try and be very aware of what's going on in your body, what's going on around you. And you may notice something like a plant and just focus on the plant, and then it has roots and the roots go into the ground. And, so it's that being able to have non-judgmental observance for kind of all aspects of experiencing. But as you're practicing it, you're usually focusing on one at a time. Like you might be focusing on, I'm just going to have non-judgmental observance of, say, mental events. So you're just going to notice what arises in your mind. And that can be thoughts, it can be images, it could be memories, it could be expectations, all different kinds of mental events. But instead of fusing with those events and kind of looking through them, like your thoughts whip through your mind and you just kind of look through them, you kind of distance it from yourself and you look at it. So you separate kind of self from mental events, or self from physical sensations, or self from something outside of you, and that you just observe it. And you don't judge it as good or bad or painful or not, or it just is. So that's just kind of like a quick thumbnail on what mindfulness practice kind of looks like, and the benefits of being able to create that gap between what you might experience as yourself and a thought or a physical sensation allows people to differentiate my thoughts from me, or my feelings from myself, or my physical sensations from me. And then you're put into a space where you generally can then respond rather than react to all that's kind of going on within you and without you, outside of you. You create a gap there. So instead of just reacting to everything, you have this space where you can observe it and then decide how to respond. So as you're practicing, you don't respond as you're doing your mindfulness practice, but then as you go about your day to day, you create this sort of gap, which can be this kind of response gap, but it also tends to be really peaceful for people because you sort of exist minus all these things going on inside of you and outside of you.
That's beautiful. How have you seen it help your clients, especially those with concussions? What benefits have you seen people have from it?
Well, one is they can develop a different relationship to those things, like to their mind or disturbing thoughts, or to their body and disturbing physical sensations. So that if you can differentiate those things, then one could have more of a compassionate response, more of an observer, a curiosity. And by doing that, you lower resistance, which again, it's sort of natural to want to resist things that are painful or hard, but usually the resistance creates more problems. And again, not that we shouldn't try and decrease pain. That's not what I'm saying. But in the moment when these things are arising, to develop a different relationship with them.
I think that's a really interesting point because that over and over and over again in conversations that I have with people, when they say the kind of turning point for them in their recovery is when they accept what's happening. And exactly what you're talking about. I love that it sounds like the mindfulness is kind of a step towards that acceptance. You can observe it and not have it mean anything about you in particular, or, you can just let it be. And just that act of doing that somehow, getting to that point, allows for healing and more progress to happen. It's fascinating to me. I'd love to hear if you have any thoughts on that.
Yeah. Oh, well, I do. I actually love this concept, which is one thing you could call it is the acceptance paradox.
Yes.
That the minute that you accept something, it kind of goes away. The other thing that you touched on is what I would kind of think of as maybe a meta response, in that you have whatever the experience is, whether it's a bodily sensation that's uncomfortable or a thought that's uncomfortable or some sort of mental event that's uncomfortable, or oftentimes it's the reaction to it that is the issue, and that the reaction is typically very automatic.
Yes.
And so that it's the reaction where one can have a lot of flexibility. And then when you change the reaction, you can change the nature of whatever the stimulus was.
Yes, that's so fascinating. And I think that, kind of tying in what you were saying before too, that allowing, what the mindfulness does is allows you to take that pause, and that pause is what is so helpful in determining how you respond and not having those automatic reactions that are not helpful and can be problematic.
So typically there's a lot of work to do on the reaction, but mindfulness is a way to create the gap. So mindfulness isn't an end all be all or, a panacea, but to foster that capacity that we have to create the gap, mindfulness is a wonderful way to do that. And it does it in this very open way, which is really important to then modify the reaction. And then as you modify the reaction, then you paradoxically change the thing itself that you're reacting to. And that's the sort of mind-blowing part of it, where people are like, oh, it's still there, but I experience it so differently now. And it's a wonderful thing to observe. It's one of the things that kind of keeps me doing the work that I do. Is I love those moments, and it can actually change very quickly. And it's this sort of beautiful, glorious moment. And all of a sudden it's like, oh, but it really is an aha experience. I can sort of describe it. Maybe it sounds kind of like woo woo or something, but it really is that So kind of changing the reaction to whatever it is changes the thing itself.
So fascinating. And you're right. It is an aha moment. It really can be such a revelatory kind of experience, like, oh my goodness. And then everything can be different after that. It is crazy. Just so fascinating. But also, I think as we're saying this, like it's a moment that can take a long time to get to. And that's okay.
Yes.
If you're not there yet, it's okay.
Yes.
Yeah, the journey.
And it is a process. And again, mindfulness is a useful practice to kind of help create that gap, but it doesn't necessarily get you to that moment. And there is work to do on the reaction itself. That there's a lot more to be done with that. The resistance or how you react to those things cognitively in your body, so it is a process, and it isn't just like, oh, I'm going to practice mindfulness and all of a sudden I'm going to feel instantly better.
Yes, sadly. I mean, I wish it was like that. That would be a great, just, cover everything thing. But you're right. It is not like that. It's a lot more complicated.
Another thing that I do really like about mindfulness is that it does create a certain level of self-awareness. And again, that differentiation of what is you from all of these sensations, thoughts, what's going on outside of your mind and body is you can actually develop this sense of, people call it different things, but I'll just call it a self that's separate from all of that. And that can be a very empowering and sometimes very peaceful realization. So that's kind of what I mean by self-awareness, but you also can become more aware of what even your thoughts are, your body sensations are, or more aware of what's going on in your environment. So I also mean increased awareness in that sense too.
Yeah, so good. Thank you for all of this. Are there people who shouldn't use mindfulness? Are there any contraindications to practicing mindfulness in any way?
Yeah. So people who have had significant trauma, when they go into that space, sometimes it's called the hub, where that space I'm talking about that's differentiated, or what I was calling a self, from mental events, physical sensations, outside world, body sensing, that kind of thing, that core, that oftentimes people have had certain types of trauma, have trouble having built the core. And so when they practice mindfulness, it can be terrifying because the core isn't there.
Oh,
yeah.
Okay.
So they go to turn their attention to the core, and it can be terrifying. So I think mindfulness needs to be used responsibly and carefully with people with trauma. There's certain types of mindfulness kinds of exercises that might be totally appropriate for maybe dealing with pain or something like that. So I'm not saying it's like an all or nothing, but depending on what type of mindfulness exercise one is doing or what the goal is with the mindfulness, that there would be some carefulness one would need to do with people who have a significant trauma history, because you don't want to leave them feeling kind of coreless.
Can you just, I don't know, for myself and maybe anybody else listening who was like, oh my goodness, like that's scary. Maybe I shouldn't do mindfulness with anybody. Is there like specific things that we should be aware of in somebody's history that would be like, okay, when you say significant trauma history, can you give a little bit more detail into what that might look like?
Yeah, so usually it's people that have had sort of repeated trauma, often in sort of childhood, where it was really hard for them to develop a sense of self because they would need to be so hypervigilant and so focused on the people around them. Usually it's people close to them that are abusing them, that are often also very invalidating, like treating the child or the person, certainly can happen to adults too, that kind of gaslighting them, telling them that this is good and this is what love is, or also really threatening them that if they share or say anything about this experience, so they really have to push it away and kind of, that if they share any of this, they'll do violence to the person or to someone or something that they care about. And so that developing that kind of core safe sense of self was really hard to do. And getting into certain kinds of mindfulness states can just feel really traumatizing because there's sort of feels like there's nowhere to go.
Okay. So someone who's had something like that in their past might be we want to have them working with a trained therapist to work through those. Okay. And not necessarily diving into mindfulness or whatever.
The other thing that I would say is someone who has really significant ADD, it's not that they can't do mindfulness, but it's going to be a struggle. And mindfulness exercises, I will just say, are not easy. And people think, oh, I do mindfulness to relax. Now, yes, there are mindfulness work that people do to relax the mind and body, but mindfulness is used in all different contexts for different kinds of purposes. So mindfulness is also an attention exercise because you're focusing attention on a certain thing, and attention is to maintain on a certain thing is hard for everybody. But it's going to be particularly hard for people that are, kind of have ADD, ADHD kind of issues. And so it's not that they shouldn't practice it. It's just that it may well be very frustrating and they might have a hard time finding benefit from it.
Okay, I appreciate you bringing that up because that is something that a lot of times people say. And from my understanding of mindfulness, it can be so broad, there's so many different ways to practice it that you can usually find something that will resonate with a person. And maybe it is like going out on a walk and just being really mindful in nature versus sitting down and like just trying to focus on your breathing. Like those are both great mindfulness practices, but you might be more suited to one than the other. And I always tell people mindfulness is great on so many levels, but one of the things is, a couple of things that a lot of times people with concussions are dealing with that mindfulness can be helpful with is the emotional state. It can help you be more aware of where you're at in your body and also like help you calm down. But it is the act of concentrating and practice. And a lot of, when we're practicing, we're noticing our thoughts going, we bring back to the moment. That is the act of focus and attention.
Yes,
and
it's attention.
You actually are practicing it and you can improve that skill. So even though it can be so hard, that it is actually really helpful. But I think it's a really good point you bring up that, if attention is challenging, which is very common in people in this population, then this could be, even though it's might be frustrating, it can be a really great practice, but you might want to just do it in like smaller sessions or something, just like to practice it and work towards it. But it can be beneficial in addressing that specific issue.
Yes, which is actually the primary way I use it for people that are coming to CFX is I actually use it as an intentional exercise, not intentional, attentional, to help with attention, especially as they're going through treatment. I want them to be able to be attentive to the treatment tasks that we're giving them. So that actually is the way that I use it. So You've talked about there's different kinds of mindfulness practices, which is certainly true. There's many, but also that there's different purposes and that the particular exercise one is doing in mindfulness can have vastly different purposes, and that the exercise itself is usually in line with the purpose. So, like when I do a mindfulness exercise, the attention one that I do can feel very different than other kinds of mindfulness exercises people might have done prior to coming, and that they use it for maybe relaxation or something like that. And so the actual things that we're doing can be really different and feel really different.
Yeah. Awesome. Thank you for bringing that up.
Mindfulness isn't a monolith, like, oh, I'm going to practice mindfulness. It's like, well,
what kind? How are we doing
it? For what purpose and what sort of exercise are you doing? And
Yep. So good. Thank you. I think that's excellent. And just really quick, do you have any like things that people could look into if they're like hearing this and like, oh, what is this mindfulness stuff? I want to play with it. I love you mentioned the grounding exercises. Are there other things that you would encourage people to just maybe play with a little bit?
Yeah, there are a lot of actually pretty good apps out there for mindfulness and things that you can find, on the internet, YouTube, that sort of thing. But what I would say is pay attention to your own purpose. So, for example, if you wanted to use it for chronic pain, then I would say, look up John Kabat-Zinn. His stuff is all about using mindfulness to help with chronic pain. If you want to use it for relaxation, then the Calm app if you want to use it for more what I would consider like mindfulness kinds of things, and you might want to look in, I shouldn't say mindful, use it for thoughts, then you might want to do something like Headspace. So just thinking about your purpose in going into using mindfulness, and then kind of look up things in that direction. But there's so much that's really available and really great programs out there.
Yes, beautiful. Thank you. I'll link to those things that you mentioned specifically. And yeah, and I'll throw out, there's one that I really like too called Insight Timer. I'll probably link to that. So many, you're right. There are so many ways to access it these days. It's fabulous. So, and I like your point about knowing why you want to do it, and then just, you can look up and there will be tons of things available. So, thank you for all of that. So I know okay. This is good timing. We have one more topic that I'm really, really interested in hearing your thoughts on, and it's about teenagers. So I think that it is so easy to dismiss concussion symptoms in general as being due to something else. That's for general population. Just, to attribute the GI distress you may be having to a bug that's going around, or fatigue to just not being able to sleep as well. But those specific things can be related to concussion and not just because of these other things that we want to attribute it to. But I think that especially for teens, it's hard to tease out if the symptoms they're experiencing are due to concussion or if they're just a normal part of being a teenager, because already we know they're dealing with hormone things and so much is changing anyway. So how can parents tell if the irritability or emotional outbursts or drama that their teen is experiencing is normal for that teen, or if it's concussion related? That's a broad question. I think it's a really important topic to bring up.
So one of the things that I don't remember if I addressed in the previous podcast, but is the overstimulation that is very common in concussion. And there are kind of physiological reasons that people are getting overstimulated when they're concussed. And so part of overstimulation typically involves increased irritation because your system is overwhelmed. And when your system is overwhelmed like that, it will activate that branch of the nervous system that's designed to activate the body anytime we're under any kind of challenge. And that, again, that operates on a continuum. It's not an all or nothing. But one of the ways, if we're feeling challenged, that branch of the nervous system as it activates the body, is that there is this sort of qualitative kind of agitated, irritated piece that's your body trying to tell you, hey, we're under challenge, like push back, like do something. And so it's meant to be grabbing someone's attention and motivating, like, get stuff away from me. I'm maxing out here. And so there's going to be that sort of agitated, it serves a really important function for us. And there's also going to be an urge to push away, whether that's verbally and telling someone to shut up, or whether that's walking away, or, even pushing something. So that is a natural part of overstimulation, and why someone is getting overstimulated. You can be overstimulated for a lot of reasons, but people with concussion get a particular type of overstimulation due to kind of brain overstimulation, where there's just really too much going on for the brain to process, given the truncated resources the brain has in concussed state. So one of the ways to kind of tell the difference, because certainly we can get overstimulated emotionally for all sorts of reasons, but to know the difference between what might be kind of concussion-related brain overstimulation versus overstimulation for other reasons, is that brain-related overstimulation typically has more than irritation associated with it, and it'll have concussion-related symptoms that rise with the irritation. Examples could be like head pressure, vision changes, cognitive fatigue, changes in verbal, harder to find words. So one ways that teens themselves or their parents can start to differentiate is to think about identifying what that teen's overstimulation indicators are for brain overstimulation. One of them is likely to be irritation, but they will have others. So if they're noticing the irritation and the other sensations that are more concussion, that are also concussion related. That's one way to kind of tell the difference between, am I irritated because this is brain overstimulation, or am I sick of my classmates at school? Like, because that irritation won't necessarily be accompanied by some of the brain kind of overstimulation.
Okay, that is so helpful. I really appreciate that delineation there, like to be able to kind of tell what might be the underlying cause there. So that's very, very helpful. And when we're talking about this irritability, any specific things that you would recommend? Recently I was talking to two teenagers. It is just last week that they were telling me, each of them separately, like they weren't together, but they both mentioned this. It kind of broke my heart a little bit, that they get so annoyed with their mom, specifically their mom, when she's trying to help them. And they know it was really interesting to hear this, like, self-awareness. I was very impressed with these guys. There's a girl and a guy, and they said they knew that their response was uncalled for and was bigger than it needed to be. And they didn't like that they were lashing out, and they felt bad about it, but they just felt like they couldn't control it. They couldn't help getting so
Yeah.
irritated responding that way. So what would you tell them, and what would you tell their moms?
Yeah. So one thing is, and you sort of already mentioned this, is that it's hard to see your children in pain and suffering, and the immediate thing, as I was sort of referenced before, is that you want to jump in and help, but sometimes our desire to help is like our worst enemy in terms of actually helping, which is so counterintuitive. But on sort of in defense of mom, she's just hates seeing you in pain and you're sort of saying these kids are aware of that. They know, these teens know that. But as far as some things to actually do with that is to begin to become aware of and sort of an expert in your own overstim reaction. So to be thinking about stimulation on a 0 to 10 scale, and that probably during most of your waking hours, you want to be in what I would consider maybe a mid-range-ish Goldilocks zone, where you don't have too little stimulation, you don't have too much. So you're not necessarily shooting to be in some relaxed Zen state all the time. No, that's not a way to live life. And so, if people just sort of say to you, if you're feeling like, oh, just go relax, you're just like, so, kind of shooting for that Goldilocks zone, not too little stimulation, not too much, sort of just right. But to start to recognize the early indicators. Typically, there'll be things that you notice in your body and sometimes in your behavior. The early indicators is when you're headed past your kind of mid-range or your Goldilocks zone. So those will be different for different people. But some of the common ones for someone concussion, where it's brain overstimulation, is that they will notice that irritation, but they'll also notice things like I just mentioned. They'll notice cognitive fatigue. They'll notice changes in vision. They'll notice head pressure. They'll notice changes in verbal behavior. They'll notice sometimes glazing over, where it's hard to sort of pay attention or stay with things. Some people describe it as they sort of hit a cognitive wall, where it's like I'm slowed, or things aren't coming in and out. But to figure out what one's own indicators are, so you can catch them early. And then if you catch them early, then that's a signal for you to do something that is de-stimming for you. So with concussion, some de-stimming things are things like brain waves, extended exhale breathing, closing and covering your eyes, or eye massage if you've got a lot of kind of visual issues associated with your concussion. Some people find it really destimulating to go for a walk. Some people just want to go be alone somewhere and maybe listen to music that's enjoyable for them. So thinking about what is de-stimming and sort of having that, so that when you're noticing that those things are rising, those indicators, that you can pull back and do what you need to do to bring yourself back down into your Goldilocks zone. The way that parents can sort of be aware or help with that is to, and the teens sort of interacting with their parent, is to just sort of explain the 0 to 10, and that using the number system to communicate about their state. So it doesn't have to be a big discussion. And when you're in an overstim state, is not the time to talk about it or even talk about what to do about it. And so the teen can start to just kind of maybe hanging out with the family at dinner or something, and starts to notice, gosh, whoa, I'm really headed up. I'm headed for an 8 here. Is to just then say, I'm in an 8. And then they may then just leave and go do what they need to do to de-stim, but that the family or the mom or whomever then doesn't take it super personally, where the teen's leaving the table and they think, oh, they're in a huff, or you can't leave the table, come sit down here, you eat dinner with us, and when the teen's just like, I'm just trying to de-stim, and then it becomes this big fight or this tension. It's just like, I'm in an 8 and everybody knows what that means, and it's nothing personal. It's, and then also then can provide something for the teen to indicate without having to say, you're all too loud, just shut up, I can't stand how loud you are. Or, it's just like, I'm at an 8 and they will be sound sensitive or vision sensitive or whatever, but that the family then knows that, or the mother then knows that. And so, the mother can then be like, okay, this is not a time to talk or problem solve, and that the teen is responsible to go do whatever they need to do to de-stim. And so using the numbering system can really help with neutral communication that is short and sweet, right? So on the parent end can, if it's all right with the teen, the parent can sometimes notice when the teen is overstimming, when the teen might not be realizing yet, or just isn't self-monitoring in that moment, is to then be able to ask the teen, hey, what number are you on? Which gives the teen an opportunity to check in with themselves and decide what they want to do about it. Rather than parents saying, you need to go de-stim, you need to calm down, you're out of control, like nobody wants to hear that. And really, only the teen can check in and decide what to do, and ultimately decide if they're going to de-stim or whatever it is that they need to do in that moment. But it shifts the responsibility from the parent to force the teen to do something. It's just like, hey, what number are you on? I would also encourage parents to use that phrase if they do want to engage the teen about something. They're not necessarily noticing that the teen seems overstimmed, but before they launch into something, like, oh, hey, let's go to dinner even, or let's, like, I want to talk, is to just say, hey, what number are you on? So that you can check out the teen's state before you launch into something or instigate something. And it's just a respectful thing to do to anyone with a concussion if you're wanting to instigate something with them. And by instigate, I don't mean instigate an argument. I just mean instigate anything,
right.
Interact.
Yeah, oh, that's so brilliant. Yeah, I really love that last point, especially that you made. Yes, because it does show a level of respect and understanding. You're just like, I'm aware of what you're dealing with, and I want to be with you, but I also want to see what you're capable of doing, and that's really beautiful.
Moment, right?
Yes, in this moment. And it's also a good way of making sure that question of what number are you at doesn't become just an indicator of, hey, you're being a punk, go like check yourself kind of thing. Like you're using it as a legitimate question in multiple settings, which I think could probably be helpful.
Yeah, and it really is meant to hopefully respect curiosity. It's like, hey, what number are you on? And you can be curious for different reasons. One is you're noticing something and you're wondering what their state is, or hey, what number you're on, because I want to know whether or not you're up to doing something. So again, you can just use that, and you can use it for a state of curiosity for all kinds of reasons. You can be curious about a lot of things. So just, I want to know what number you're on so I can figure out what my next step is, kind of a thing.
Yeah, and it's so neutral. Like it's not requiring them. Like if you are using it in the case of, I think it'd be really fun to take the family to the pumpkin patch. Are you up for that? Like rather than asking all of those things, you just find out where they're at. Right. Then you could ask maybe, but like they don't have to come up with, well, I don't want to, but I feel bad and I have this going on, and like they don't even
exactly
and explain all of the things that are going on for them. They can just say,
you got it. You want it short and neutral. Yes. So with the 0 to 10 on the teen side, certainly would want them to communicate through the numbers when needed. Like, again, coming home from school, walking through the door, I'm at a 9, but also to use the bottom end of the scale. So then, like, mom knows, like, again, and it's not nothing personal. It's just, this is what I'm dealing with. And so we can be a team. Instead of it coming between us, we can be a team that can just hopefully kind of work together or be mindful of it. Right. So I'm at a 9, and then mom's like, oh, all right. So, and then if there are things that the teen would want from the parent or a family member when they are at a high level, maybe they just want to go somewhere alone and destim or whatever, but that can also be part of the destim plan. So it's actually really helpful if I'm at a 9, if you bring me, because that usually means my headache is crazy high, if you bring me Tylenol or whatever, but that can be something you would agree to beforehand. Or, it's really when I'm at a 9, it really is helpful for me to have a cooling, sometimes, some people get really hot when they're temperature wise, when they're overstimming, and that they really benefit from having an ice pack or something. So if I come in and say that I'm, at an 8 or a 9 or a 10 or something, bring me an ice pack. Right. So, but sometimes people don't want the people around them to do anything. They just want to be left alone, be able to go do something that's destimming for them. So that's an agreement they were kind of come to prior, and when just sort of talking about 0 to 10 and destim, but for the teens, so to use those numbers, but then also to use the bottom end of the scale, so that if they are at a 4, that they then approach mom and say, hey, I'm at a 4. Did you want to have a discussion about blah, blah, blah? Or this would be a good time for us to, I'm happy to unload the dishwasher now. Or, is there some chore you meant for me to do today? Or could you help me with my homework now? Because I'm at a 4, so that the scale isn't, from the parent's perspective, used exclusively as some sort of an excuse to check out. Because yes, people with concussion do need destim time. Absolutely. But it can start to feel that way to the parent if it's just, an 8, can be just like, that you use the bottom of the scale to approach.
Love it. Okay. Yes. So it's important for both parties to use both sides of the scale. I think that's so beautiful and so important. Like you were saying, it's so empowering and this ability to communicate quickly. And the key part of this is that it's all agreed upon ahead of time. And it's gonna change probably. Like you're gonna be able to, you'll have more experience with it, and then you might want to adjust how you define it. But yes, but so beneficial, and approaching it ahead of time can be before you're in that 8, 9, 10 state is really helpful. I love this.
I would just add quickly is that the irritation is a useful indicator and is there for a reason, because your system does feel overstimmed and it does want you to get stuff away from it. And so when the teen is experiencing that, to acknowledge it. Now, it doesn't give you a reason to go cuss somebody out or, whatever. It doesn't give you permission to do that. But to just recognize it for what it is and like, yeah, I am really overstimulated. And this is one of the ways I know that. Rather than parent or teen thinking, I shouldn't have that. It's bad to have that. I have to squelch it. It matters what you do with it. Again, it doesn't just give you carte blanche to yell at people and, be a jerk and that kind of thing. But it's a really important indicator, and it's energizing so that you can get what you need in that moment, or at least have the energy to do that, or the motivation to do something. But so there may be this sense either from the teen or from the parent of you shouldn't be irritated or mad. And I would say, yes, you should, because that's what overstim feels like. It has other sensations too. And it's an important one to just recognize it for what it is.
Yeah. Oh my gosh. I'm so grateful that you brought that point up. I think it's really, really helpful to take away the moral judgment of it. Like, it's not doesn't mean you're a bad person, doesn't mean anything about you. It's just this is how your body's responding, and it's a really helpful, useful indicator. It reminds me when I was early on in my OT career, I was working in a school system, and there was a parent who came in and they were talking about their little baby who actually, I think this kiddo was older now, but when they were talking about when he was a baby, he didn't cry. He just that was part of his thing. He just never ever cried. And so they didn't know how to help him. They didn't know if he was hurt. He didn't so it's, sometimes we think, oh, this crying is driving me crazy, right? Like this baby. But really, like if we kind of flip that on its head, it's like, oh my gosh, I'm so grateful that this is such a useful indicator to let me know what is happening for this person. So whether that's for yourself or for your kiddo, it can be, it's just
it's important information. And the idea that like I should never be angry at my mom, or mom, this child can't be, you cannot express anger at your parent, kind of thing. It's like, well, anger's there and it's there for a reason, or irritation, or, right. And just recognize it for what it is. And again, it doesn't mean you get to be a jerk, but it's important information.
Yes, such a beautiful point. Thank you for making that. And thank you so much for everything you shared today. Again, this is such a quality conversation. I'm going to be sharing it with so many people because I know it will be beneficial. Like, I love all of the topics we brought up. Thank you so much for sharing this. And how can people find you if they're interested in the transcranial magnetic stimulation, or the CO2 suits, or just working with someone like you who knows concussions, because that makes a big difference, having a provider. I'll just throw this out there before I let you tell people how to get a hold of you. If you're looking for someone and you're dealing with a concussion and you're looking for the mental health piece, try to find someone who is familiar with concussions, because it really does make a difference. As you can hear from listening to Dr. Spangler here, there's that understanding is key in understanding all of the underlying things that go into how our behaviors come out and the emotions and everything. So how can people find you and learn more from you?
So my private practice is in Provo, and they could just call the main line, which is 801-882-2204.
Okay. And this is the main line for what? Sorry, for cognitive
my private
effect?
practice.
For your private practice. Okay, perfect. All right. Do you have a website or something that they can find as well?
So they can find me on a website, the Cognitive FX website, but my private practice is separate from Cognitive FX, but they can find a lot of information about me on that website.
Okay, awesome. And then, yes, I'll put that phone number in the show notes as well. Look her up, guys.
I would also just add to that they can find a lot of information about TMS if they're interested in that on the Cognitive FX website. So if they're looking for that kind of information, they will find most of the TMS information on the Cognitive FX website.
Perfect. Thank you. And that's cognitivefxusa.com. So, but I'll also link that in there too. So fabulous. Thank you so much for being here and for everything you shared. I really, really appreciate it.
Thank you for having me. It's a pleasure.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.